Hello, I'm Tammy Dana-Bashian, Mayor of Rowlett.
And I'm Brian Funderburk, Rowlett City Manager.
Brian, it's certainly good to be back. We weren't able to record this last month. We were doing all other kinds of communications with our community, and so it's really good to be back in the studio.
It is, Mayor, and as you mentioned, we may not have done this show, but there was not a lack of communication. Whether it's digital, video, social media, we have been getting the word out there about COVID-19 this whole time.
As we begin May, we find ourselves still in the grips of COVID-19 pandemic and continue to see new cases in Rowlett and surrounding cities. We, unfortunately, still have a long way to go before our nation can return to normal. I'd like to thank all of you for working together to help keep us safe. On today's show, we're going to cover the latest information, resources, and ongoing plans to combat this health and economic crisis.
Before we begin, we'd like to make a quick disclaimer. Information regarding the pandemic changes in the blink of an eye and quickly becomes outdated. We are vigilantly monitoring this rapidly evolving situation and will continue to participate in state, regional, and local response measures. For the most up-to-date COVID-19 news regarding our city, we urge you to follow our Facebook page or visit rowlett.com/COVID-19. Bookmark these pages now. We're going to be referencing those news sources throughout today's show.
Under new executive orders from Governor Abbott, the process to open Texas has now begun. First, it is important to know that the governor continues through at least May 15th to include this same language in his orders. Every person in Texas shall, except where necessary to provide or obtain essential services or reopen services, minimize social gatherings and minimize in-person contact with people who are not in the same household. What did change is that the governor's new order now allows some Texas businesses to open at 25% capacity, with the goal to increase to 50% by May 18th, if COVID-19 metrics continue to improve. The governor's report to Open Texas is a 64-page handbook that lists guidelines and requirements by industry to open Texas businesses. It provides detailed guidance for this process and is available on the city's website. These orders are the governing documents for all of Texas. County and city orders may not restrict essential or reopen services, may not expand essential or reopen services, and may not allow gatherings prohibited by the governor's executive orders. In accordance with the governor's executive orders, City Council amended the City of Rowlett Disaster Declaration and orders and are effective through May 15th. Reopened services include in-store retail services, dine-in restaurant services, movie theaters, shopping malls, and museum and libraries may operate at up to 25% of the total listed occupancy, provided that interactive functions or exhibits, including child play areas, must remain closed. The 25% occupancy limitation set forth for the reopened services shall not apply to essential services. Also included in reopened services are golf course operations with limitations on the number of players, services provided by an individual working alone in an office, local government operations, including county and municipal government operations relating to permitting, recordation, and document filing. In addition, the order covers the following. Religious services should be conducted in accordance with the joint guidance issued and updated by the Attorney General and the Governor. People may continue to visit parks, hunt or fish, or engage in physical activity like jogging, bicycling, or other outdoor sports, so long as necessary precautions are maintained to reduce the transmission of COVID-19 and to minimize in-person contact with people who are not in the same household. All licensed healthcare professionals can return to work as long as they meet their licensing agency's minimum standards for safe practice during the COVID-19 disaster. Also included in the order, hospitals are to reserve at least 15% of their capacity for treatment of COVID-19 patients.
And this is just in from the governor's office. Personal service businesses like barbershops, hair salons, and nail salons are allowed to reopen beginning Friday, May 8th. It's one customer per stylist, and you must maintain 6 feet distance. Gymnasiums and fitness centers will be able to reopen May 18th at 25%. You must wear gloves and maintain 6 feet distance. Showers and locker rooms remain closed. Non-essential manufacturers and other offices will be able to reopen May 18th to the greater of the following: 5 employees or 25% of the workforce. Weddings, funerals, and memorials may now take place with the same regulations as religious services. Bars cannot reopen yet. They are currently under assessment for guidelines to open in the future.
Schools remain closed and visitors are still prohibited from long-term care facilities. Future phases to reopen Texas will be based on protecting the most vulnerable, widespread testing, and preserving hospital capacity for COVID-19 patients. If the metrics continue to improve, the next phase will begin on or around May 18th.
So what does this mean for the City of Rowlett as we evaluate our next steps? Most recently, the Rowlett Public Library has begun curbside pickup. The next stage may include reopening the library at 25% occupancy when we're ready. The governor's orders specifically call out municipal governmental operations, including services provided by our Community Development Department. But the caveat is, as determined by the local government. That means we are evaluating how and when we may reopen city facilities in a manner that will keep our employees and customers safe. Please make note, city services have been open virtually during the entire pandemic, providing essential services to meet the requirements of the executive orders. It will be some time before programs and events come back online. Currently, we expect Memorial Day to be a virtual ceremony without the touch-a-truck and entertainment component that we traditionally have had. The same is true for summer reading at the Rowlett Public Library. The library is working to create a virtual summer reading program to start the summer, which may include some physical events later in the summer when appropriate. Clearly, the wet zone will not be open by mid-May. At this point, we do not know if or when it will reopen, but we will let our employees and public know our plans when we are certain we can open safely. It is critically important to continue to follow the health guidelines as we reopen Rowlett. Stay home if you can. Wash hands often and for 20 seconds, or use hand sanitizer with at least 60% alcohol. Cover coughs and sneezes with a tissue, then throw the tissue away. Avoid touching your eyes, nose, and mouth with unwashed hands. Disinfect surfaces, buttons, handles, doorknobs, and other plates touched often. Avoid close contact with people who are sick. Continue to practice social distancing. Avoid crowds and limit physical contact. Wear a mask or cloth face covering in public to help slow the spread of the virus. This is especially important in cases where social distancing is not always possible, as we are finding that there is a significant percentage of the population that is asymptomatic but can be carriers. We must continue to be vigilant and take appropriate precautions when out and about in public. We all want to return to normal, and to get there we need to proceed with a strategic and measured approach. To inform and guide the community on how to reopen Rowlett from the COVID-19 pandemic responsibly and gradually while protecting our most vulnerable populations and maintaining a fully functioning healthcare system, the city has launched an initiative called Reopen Rowlett Responsibly. Governor Abbott indicated the reason we have come so far in mitigating the spread of COVID-19 is because everyone has been so diligent about physically distancing measures and staying home when possible. Some of the challenges we will face as a community in the process to reopen Rowlett include timely and effective communication to our public and our businesses, specific interpretation of guidance from authoritative bodies, lack of sufficient testing, lack of sufficient personal protective equipment, and resources needed to continually isolate infected residents and trace and quarantine their contacts. Under our Reopen Rowlett Responsibly initiative, we will partner with many Rowlett business owners within our various industry groups to develop, implement, and communicate specific plans to reopen Rowlett with a safe and measured approach within the guidelines issued by the national, state, and regional authoritative bodies. So, Mayor, as you know, we have started the work to figure out the safest way for Rowlett to reopen. I know everybody is excited about this part. We're certainly taking our guidance from the governor, but we want to make sure that we can protect our most vulnerable and that we can reopen safely.
You know, so many people have sacrificed so much over these last 6 weeks, and our businesses have sacrificed so much, and they really want to partner with us effectively and safely, because we all know if we don't do this the right way, we could end up going backwards. And that's the last thing we want to happen. So we're very, very thankful for everything everybody has done so far, and we're really excited to be able to work really, closely with all of our businesses to help us figure out how to do this the right way. Joining me today is Ed Balderas, Emergency Management Coordinator for the City of Rowlett. I want to go through various questions that our residents may have, and first, let's talk about how and when are positive results reported in regards to COVID-19 testing, and what is the normal time lag between exposure and a positive test?
I would like to first answer that question by stating that several Texas laws require notification of confirmed or suspected COVID-19 cases to local, regional, and state health authorities. In some cases, failure to report a notifiable condition like COVID-19 will result in a penalty, a criminal penalty. That said, the general expectation is that a physician and/or test provider will notify a patient of a positive result first and then notify the appropriate health authority. The health authority would then notify the Public Safety Answering Point, or PSAP, which is our dispatch center, of the jurisdiction responsible for providing public safety response to that resident's listed home address, which would typically become the patient's required quarantine location. If a staff member of a long-term care facility in Rowlett tests positive, then our health authority would notify us of this positive case, regardless of where that staff member lives. This is the expected process. However, several factors will influence that process, and it may be more or less complicated. Depending on who is providing the testing and what kind of test is being provided, we could receive notification within a few hours or a few days. Generally, the reporting lag has been significantly reduced from over a week in most cases to just a few days. The lag between exposure to the virus and the likelihood of receiving a positive test result will depend on several factors, such as the type of test, when a person is tested, and the viral load present in that patient. Because people usually only get tested after symptom onset, and the incubation period typically lasts between 1 and 14 days, with 5 to 7 days seemingly being the most common incubation period. It's very difficult to determine a standard lag between exposure and a positive test result. However, given immediate access to testing, the lag time for a symptomatic case is likely to be a max of 14 to 17 days. However, that has not been based on any research literature I've reviewed. However, that is the most likely the reason why we were given about 2 weeks to determine whether or not phase 1 is effectively reopening the state. So,
very complicated, very involved, lots of factors out there that play into all of this. And it's just shows how important it is to stay up to date on the information and really obtain a thorough understanding of what's going on.
Absolutely, and the CDC guidance changes almost every day, so it's important to stay up to date.
I say thank goodness for Ed every day. So let's talk about what happens if a resident gets a positive result in Rowlett, and what do we do to help that individual and their household?
Well, when we receive a positive result for a Rowlett resident, we flag that resident's address, the quarantine address, which is determined by Garland Health. Garland Health provides the positive resident and household with guidance and information on who to call from the city for assistance to ensure that they are not forced to leave their property during their quarantine period.
And what does it mean, Ed, when we talk about a recovered person, and what happens to that household even after a specific person within that household has recovered?
Well, every quarantine case is monitored daily by a case manager from Garland Health. In determining who is deemed recovered, Garland Health uses the State of Texas Department of Health Services non-test-based strategy for releasing cases and contacts from home isolation and quarantine. As the availability of at-home testing and other testing processes increases, this process may change. Each case is different, but typically an individual is deemed recovered after being symptom and fever-free for at least 3 days.
And then what happens to members of the household even after that patient has recovered in regards to, do they have to be quarantined and for how long?
Well, each household contact is determining high-risk exposure to COVID-19. So even after the 3 days of being symptom and fever-free, that household may still be under quarantine for at least another 14 days.
So please, let's talk now about what is the current state of our regional medical resources, hospital bed availability, ICU beds, ventilators, and other respiratory equipment, as well as PPE.
As of the end of April, our region has a little over 15,000 hospital beds with about 5,500 or 36% available. About 600 ICU beds and 1,400 ventilators are also available. With just over 600 hospitalized lab-confirmed cases, our region is doing relatively well. However, I do want to point out that some hospitals may be seeing a surge in patients while others are not. This is often due to capacity and capability characteristics of that hospital.
What is our current state of testing? What kind of testing is out there? And where is most of the testing occurring, Ed?
Quite frankly, nationwide testing is not where it should be for the surveillance capacity necessary to properly manage this pandemic. However, testing availability and quality in our region has increased significantly from just a month ago. From drive-through test sites, point-of-care sites, and mobile testing sites, testing is readily available for most, regardless of the ability to pay. On the city's testing page, we've included a link to a map of testing locations across the state. For example, 40 testing sites are located within 20 miles of City Hall. Both the diagnostic test meant to determine if you are currently infected and the antibody test meant to determine if your body has developed antibodies against the virus are now readily available. However, while the diagnostic test is helpful in surveillance and determining treatment, the value of the antibody test has not been yet proven. Additionally, there are many fake tests and tests that have not been reviewed by the FDA, so I caution anyone seeking to be tested without a physician's order to visit our webpage or the CDC's testing page to determine the best course of action.
And help the public understand, what percentage of testing is being done through, referral by their private doctor, and then versus those public testing sites that people can access also.
What we're seeing now is roughly a 90 to 95% testing from private sources, private labs, and about 10% coming from public labs.
So our recommendation to the public is if you are sick and you experience any of those COVID-19 symptoms, to call your medical professional first.
Yes, you should go through a primary care physician, and if there is an inability to pay, lack of medical insurance, then one of those public sites may be the best course.
And all of this information is on our website and readily available.
Yes.
So what is the current criteria for testing?
Well, we have two public test sites in Dallas County. One is at the American Airlines Center and one is at the Ellis Davis Fieldhouse, which are now operating Monday through Saturday, 8 a.m. to 5 p.m. and Sunday, 8 a.m. to 12 p.m. Those times will vary depending on how many tests have been conducted, so they may close early or they may be open the entire day. Criteria for testing, as reported to us at the end of April, is as follows: anyone with a temperature of 99.6 or higher, and shortness of breath or cough. Anyone 65 years old or older, regardless of symptoms. Anyone with chronic health issues such as diabetes, asthma, heart issues, regardless of symptoms. And any first responders, DART drivers, healthcare workers, grocery store and essential retail store workers, regardless of symptoms.
So can you talk a little bit about our telemedic program here in Rowlett that has been so important and effective for us?
The telemedic program is a 911 call video screening process designed to limit first responder and citizen exposure to COVID-19 cases, reduce unnecessary transports, and reduce the use of crucial PPE. We want our residents to call 911 when they believe they need emergency medical assistance. However, this program will allow us to determine if certain residents may be better served through atypical EMS service. We have a great video describing this process on our YouTube, Facebook, and city web pages, and I encourage people to view that.
So Ed, we recently formed a Rowlett Ready co-ad, and so talk a little bit about what that means and how that is helping us during this pandemic.
Sure. Rowlett Co-ed, it stands for Community Organizations Active in Disaster, also known as Rowlett Ready. This is a community-based system where churches, nonprofits, and other organizations are able to provide assistance to Rowlett residents impacted by this disaster. I encourage everybody to visit rowlettready.com or email needs@rowlettready.com if you need local assistance from volunteers.
So Ed, there's lots of ways we've been keeping our residents and community informed. Can you talk first about our Connect Rowlett Smart 911 system?
We have a system called Connect Rowlett, or Smart 911, where a resident can register to receive emergency notifications from the city. These notifications could be for any street closures, any other citywide closures, any emergencies such as criminal activity, and also severe weather impacting the city. There are different ways residents can sign up to receive that notification. They can choose to receive a text message, email, or phone call.
And there's a great video on our website that explains how to sign up for Connect Rowlett. So please view that video. So in regards to the other forms of communication, we want our public to know we will continue to inform the public about any new cases, and we do that on our website and on our social media sites. But we will restrict that information to age range and gender as it is available to us. Please visit rowlett.com/COVID-19 for more information. You can keep up to date with information real time on the city and my mayoral social media sites. Please read our bi-weekly newsletter, Friday at 5. You can obtain that on our website, you can obtain that on our social media sites, and you can subscribe to receive that directly to your email inbox. Tune in to city council meetings. You can do that live or via video when you can have time to view those meetings at a later time. And please view our live stream on our website or via cable access channel RTN 16. Lots of ways to stay informed, Ed, and this information changes not daily, not hourly, but by the minute. So it's understandable. We have a hard time keeping up, so it's very understandable that our public is having a hard time keeping up. But we are trying very, very hard to push that information out to everybody. And personally, thank you for everything you are doing. I know it's been an exhausting 6 weeks, and we are not over this yet. So we're in this for the long haul for a while.
Thank you, Mayor.
Hey Rowlett, I'm Emmy, a communications officer. The Rowlett Emergency Communications Center takes 911 administrative calls and dispatches police, fire, and medical services for the city of Rowlett. Connect Rowlett is an easy-to-use application through Smart 911. You can sign up online or through the Smart 911 application. The Smart 911 app is free to be downloaded in the Apple Store or Google Play. When you sign up, you can receive tailored alerts based on your specific needs and geographic location. This application helps you to stay up to date with things going on in the city. It is important to sign up today to receive alerts from Rowlett officials. You will receive reliable information about the changing coronavirus situation. When you create a Smart 911 profile for your household, you will be able to provide critical medical information for those who might be at higher risk of contracting a serious illness like COVID-19. When anyone in your household calls 911 with a phone associated with your safety profile, your Smart 911 safety profile is automatically displayed to the 911 call taker, providing additional information for first responders. By signing up, you can help first responders get the key information they need about every person who may need assistance, not only during this outbreak, but during any emergency. Sign up at rowlett.com/connectrowlett.
We have an incredible organization based right here in Rowlett, and right now they need your help. Life Message has served our community for the past 22 years, 9 years as a food pantry, and is doing unbelievable work to help families in need throughout our region. They are the largest distributor of food for the North Texas Food Bank, which is also suffering greatly during this pandemic. Since the pandemic began, Life Message has seen a huge increase in demand for food, with up to 45 new families daily asking for assistance, and they have had up to 300 families needing food in one day. Life Message historically has operated a self-sustaining business model, which is currently not possible as many of their partners have now decreased their food donations due to reduced supplies and high demands. And income is no longer generated from their thrift stores due to restricted retail operations. Life Message has also laid off several employees to reduce operating costs, many of which continue their important work at Life Message on a volunteer basis. Life Message also operates the Veterans Resource and Outreach Center, VROC, which has seen increased demands from area veterans with diminished resources to service this important segment of our community. If you would like to help support this amazing resource located right here in our hometown, you can donate today. Please visit the link shown on the screen. Thank you to all the staff and volunteers at Life Message for helping so many in need right now.
If you're having a hard time during the pandemic, here are some local resources that are offering help and support. Have you lost your job due to COVID-19 and you're asking yourself, what should I do now? The Economic Development Department has an up-to-date and extensive COVID-19 business and workforce resource page on rowlettonthemove.com. One of the resources on this page is this flyer, which details the process of looking for a new job with helpful tips, telephone numbers, and links. Another helpful resource is the Dallas County Tenant Hotline. For individuals experiencing hardships with paying rent and also possibly facing eventual eviction, this hotline can provide information and help connect you with agencies and groups that may be able to provide some help. Contact them by using one of the numbers on the screen. DART paratransit drivers have added grocery pickup and delivery to its services for customers. DART drivers will pick up groceries from the store and deliver them directly to the customer for free. Riders must place their orders directly with the grocery store and provide DART with pickup ID information. For paratransit scheduling, call 214-515-PARA. That's 214-515-7272, or use the web address on the screen. With so many changes and disruptions to our normal day-to-day lives, it's completely understandable to feel troubled and stressed. To help us all get through this, the North Texas Behavioral Health Authority has established a mental health support line for those dealing with the trauma and stress of COVID-19. This phone number is 833-251-7544, and the line is open 24/7. Mayor, there are a ton of resources available out there for our public during this pandemic. I mean, it's absolutely tragic that we're here in this place and so many people need help, but there are resources.
There are, and many of those are listed on our website at rowlett.com/COVID-19, and we have lots of links to statewide resources and local resources. So, this is a tough thing. This is tough for all of us, and we hope that our residents that do need some assistance will reach out and obtain that assistance.
Now we're going to show you how to fold a bandana into a makeshift dust mask. Many different methods out there. This is just a method. So what Josh is going to do is he's going to take the top part of the bandana and he's going to fold it in half, and then he's going to fold it in thirds. And now you're going to take either rubber bands or hair ties and you're going to slip them over each end. Then he's going to fold those ends over. And now you can see that your rubber bands are now your ear loops, and then you can apply your mask as we showed you before. And then you can make adjustments as necessary to cover both your mouth and nose.
Welcome back. Due to the social distancing requirements, the City Council meetings will be held via teleconferencing. We encourage the public to view live on the city's website or via RTN 16. All other boards and commissions are suspended until further notice. To listen to the meeting live, call 877-853-5247 and enter the meeting number shown on the screen. City Council may receive public input on any of the following items. To provide comment for the meeting, please send an email to citizeninput@rowlett.com by 3:30 the day of the meeting. Please state whether your comment is regarding a specific agenda item or a general comment to council. Your comment will be read into the record during the meeting, must be within the 3-minute time limit. There will be no comments taken during the meeting.
And we'll end today's program with some final thoughts. We've been so touched by the many Rowlett residents who have donated supplies and food, expressed their thanks, and continue to show kindness and compassion toward one another. Treating each other with respect is so important now more than ever. I would like to thank our community's frontline workers, whether they are first responders, grocery store personnel, child care providers, medical professionals, or those who service your garbage. All are working hard to facilitate your needs as they also juggle homeschooling kids, changing work schedules, and the added stress of putting themselves at risk every day. God bless, and please stay safe, stay informed, stay kind, and stay home when you can. Thank you.